Hey, today our topic is dysmenorrhea. This is the next lecture in the menstrual abnormalities of the gynecological sketchy series. So we will start off with the dysmenorrhea. The dysmenorrhea can be defined as the pain during menstruation. This can be presented with this like the symptoms that will indicate the pain during the menstrual flow. There are two type of menstruation: primary menstruation and two type of dysmenorrhea. Primary dysmenorrhea and the secondary dysmenorrhea. Primary dysmenorrhea is associated with nausea, vomiting and diarrhea, while the secondary dysmenorrhea, it is characterized by the pain during menstruation and pain during sex. While there are different causes of the dysmenorrhea. Most importantly is the endometriosis, adenomycosis, and uh, pelvic inflammatory disease and cervical stenosis. While the cervical stenosis is a rare cause of the dysmenorrhea, it can be the diagnostic procedure that is rarely used is the ultrasound hysteroscopy, that is useful in the diagnosis of the cervical stenosis. While there are different specific features of a different etiology, like in the case of the endometriosis, first of all, the pain appear before the menstruation, and number two, pain appear before the menstruation, number one, while the number two is the fixed uterus, fixed uterus, and there is a pelvic mass, and there is a endometriotic nodule in the pouch of Douglas. While the specific features for the pelvic inflammatory disease is the unusual vaginal discharge and abdominal cramps or tenderness. Abdominal tenderness and unusual vaginal discharge are associated with the pelvic inflammatory disease. While next we will go on to the investigations. So the most important investigations is the endocervical or high vaginal swabs, TVUSS ultrasound, or that will indicate in large uterus in the case of fibroids, endometriosis and adenomycosis. While rarely used, laparoscopic diagnostic laparoscopy is useful for the diagnostic procedure in the secondary dysmenorrhea. It is useful when the ultrasound and swabs does not give any positive results, and there is a strong association of the secondary dysmenorrhea. While we will go on to the management of the dysmenorrhea, first of all, there is a medical management. The surgical management is rare, while the medical management, the first and foremost treatment that is useful in the dysmenorrhea is the NSAID, including mefenamic acid, ibuprofen, while LNG, levonorgestrel, intracontraceptive system, LNG IECS can also be used. Oral contraceptive pills, combined oral contraceptive pills can be used. While the heat is also an important method in controlling dysmenorrhea, and it is equally effective as NSAID or mefenamic acid, GnRH analogs can also be used, but they have a side effect of causing hypoestrogenic state, causing osteoporosis. While the surgical treatment include surgical laparoscopy, it is used to treat endometriosis and adenomycosis. This is all about dysmenorrhea. We will see on to the next chapter of the gynecological series. Till then, bye bye.